Hello, I am going to present a how-to video on how to complete the lead care spreadsheet for New Hampshire lead reporting. My name is Deanne Berthium. I'm a nurse case manager from the Healthy Home Lead Poisoning Prevention Program. Below, you'll find my contact information. There is my email, my direct desk phone number, and then the 1-800 number, just in case I'm ever on vacation or you can't get a hold of me and you have a question. Hopefully, one of my colleagues can answer it for you. This is a Word document I created for tips for filling out the lead care spreadsheet. There's certain things you have to fill in a certain way, certain dates. We'll go through that. So I suggest printing this out the first time you go to use the spreadsheet and use it until you feel confident. I will email this to you along with this video. So I'm going to go to the spreadsheet. So when you open up the spreadsheet, it brings you to the instruction page. You'll see down below these tabs here. So there's an instruction tab and a report tab. At the top, you'll see that your file name is your practice name, and then it says master. That's because you're going to only use this as a template. You're not going to save this as a normal Excel, and we'll go through the steps on how to save the test. So you're going to hit the report tab. It takes you over to the spreadsheet. You can report multiple children on this spreadsheet. We do ask that you don't report a child's lead test more than once. Um, Say, you open this spreadsheet and from a previous test, there's a child's information in here. Please remove that child's information before you put in a new test. But with that being said, there's certain columns that are pre-filled in for you. So please don't remove those columns. And we'll go through each of those columns. Also, you want to fill all the red. So you see the red columns here. All the red needs to be filled in. So we'll go through the columns that are pre-filled. So lab name, which is also practice name. So you'll see your practice here. You scroll over. Um, this one is provider name. I've noticed that some practices already have that pre-filled. If you have nothing there, don't put anything in there, please. Just leave that blank. The provider name is your practice name. It's not the provider that ordered the test. And then you'll see that your address is placed in there for you. So your street number, um, your street, city, state, your zip, and then your phone number is in there for you already. The units for the test is already in there. The type of test, the lead care 2 machine, and then your CLIA number is already there. So your CLIA number is how we identify your lab. It's your lab or your practice number. Please do not ever change that. If you change it, our system will not be able to identify your practice or your lab. So very important you don't change that. And then lastly, you'll see this pass or fail. So once you put all your information in, you filled all in that red, and you come to this column here, and if you see it says fail, there could be either you put a date incorrectly, or maybe you missed one of those red columns. So just go back through, check your information, make sure it's correct. And then once it says pass, you're going to scroll over, and then you'd use this export button to save. Um, I'm going to show you that after we do a mock test. So you're always going to start inputting on row 4, and you're always going to start on the spec date, the specimen date. So the specimen day is the day you took the test. It's very important that you put in the full date. So if you add an extra number and then you tab over, you'll see there's no dashes. So that would cause an error. So I'm going to go back. I'm going to remove the 3. I'm going to tab over, and then you'll see the dashes and the dates incorrectly. Very important that you do that. The next column is the child's last name. So we're going to just use a fake name. So we'll do Mouse. Tab over to the first name. Going to do Mickey. If the child has initials, you would put them there. It's not in red, so it's not required. The next is the house number. It's very important that you're using the child's physical address for two reasons. If the child has a PO box in New Hampshire and they're out like on one of the border, if you're one of the border practices that borders Maine or Massachusetts or even Vermont, you might have children that come over from those other states and could have a PO box that's in New Hampshire, but they live physically in Massachusetts or Vermont. Um, we don't do case management for other states. So that's why it's really important that you're putting their physical address. Also, if the family is renting their home and they have an elevation, a lead elevation, it's a home inspection is required for those rentals. So if we don't have the physical address, it's hard to identify where this child's living. So very important. Please use a physical address and ask the parents for that. I'm going to just put my office address. So the street name. If they have an apartment number, you'd put that there. It's not in red, so it's not required because obviously not everyone has apartment numbers. I'm going to put the city. Oops. And you'll see everything changes to caps. So if you're writing in lowercase and you tab over, everything changes to caps for you. So state, we just have, so there's a drop down. You see the little key here and then the caret. Click on that, New Hampshire. So we only accept New Hampshire lead tests. So that's why there's only a drop down for New Hampshire. And then you put the zip code. And then the next two columns are the patient, the guardian name, last name, and the first name. So put in a mock name. So I'm going to do Minnie Mouse. Again, if that's not pre-filled in, you're going to skip it. Please don't put anything there. And then the next column, it has one of those drop downs. It has a key for race. You'll see in the key, I is for American Indian or Alaskan Native. A is for Asian. B is for Black or African American. P is for Native Hawaiian or other Pacific Islander. W is for white. O is for other race. And U is for unknown. And then as you click on the caret, you'll see those letters appear. Please select the actual letters that are here. I wouldn't put in any letters. That way you don't make any mistake and like hit the wrong letter. And the same thing for ethnicity. There's a key here, H for Hispanic, U for unknown, and NH for non-Hispanic. Again, please use the letters that are provided for you. Just less chance for error. And then the next tab is the child's date of birth. Again, it has to be the full date. And you see that the dashes appear. I didn't put the dashes in, but as soon as I tab over, they appear. So that's how you know you put the dating incorrectly. And then for sex, there also is a drop down in a key. I would use the M or the F. I wouldn't use the 1 or the 2, and the letters are provided for you. Specimen ID, spec ID. That is, so labs have specimen IDs, practices don't. So what we ask the practice to do is put the child's medical record number. You'll see it down in this key as well. So these keys that appear, they are very helpful. So medical record number, I'm just going to put in a random number. You're not going to do Medicaid. Sample type, practice, you're going to most likely just be capillary. So C for capillary. Analyze date. For practices, that should be the same day as the specimen date. Sometimes labs, they'll take the sample and then they'll analyze it days later. For practices, you don't do that. You analyze same date. So you would put the same date that you put down for the spec date. Full date. Again, the dashes appear when I tab over because I put them in correctly. So for the result, you should know that the Leadcare machine, when it reads low, that the result that you put in should be less than 3.3. It has to be the numeric value. Please do not write the word low here. It will cause an error. Also, for you to know, what I think is very important is we send parent letters to any parents that have children that have a lead level of 3 to 4.9. Has information, education about lead, lets them know that your child may had some exposure, um, and gives them information on what to do next. It's very upsetting for a parent if they were in the office and the doctor says, "Oh, your child's result was low," or they don't have any lead exposure, and then they receive this letter because you put the wrong result down. You put down 3.3, not less than 3.3, and that can be really upsetting. So it's very important that you put that information correctly. You're going to skip over this EP result. The next column is the patient's number, so you want to do the area code. Like I mentioned, provider is actually practice name. That's already provided for you, so you just skip over that. The next column is where you put the provider's name that ordered the test. So it should be last name, comma, first name. You don't want to put any credentials here. So if you have Dr. John Smith, you're just going to do Smith, comma, John. No credentials. Your address, like I mentioned earlier, is provided for you. Just keep tabbing over until you get to the end. There's no more red, and it says pass. Perfect. So now you can submit it through, you can hit the export button to save. Before we go on to that, if you had more children to input, you would start on the spec date, because remember I mentioned that some columns are pre-filled, and they will pre-fill once you start typing in the next line here. So you want to start on spec date, and as soon as you tab over to last name, all those columns will be pre-filled that are supposed to be pre-filled, in the lines that you that were red for the previous, the things that the red that needs to be filled out will appear again. So we'll put in the date again. Remember, full date, and there you go. Those columns appear. It's very important that you don't pull down from the previous columns. For one thing, it's very important because the CLIA number here, anytime in Excel you pull down a number, it changes that number. So remember, this is how we identify your practice or your lab. And if the number is not correct, our system's not going to recognize you, and it's going to cause an error, and we won't get the test that you sent to us. So look here, you see the original ending is 29, and because I pulled down, now says 30, and then 31. So if you continue to do that, it's going to keep changing that number, and then it's going to cause an error. So very important that you don't do that. Also, if you don't have any more tests and you did, for some reason, click down here and things turned red, just delete those columns out like that. The reason is the data system will think there is a missing test, thinks that there should be something there. It's very important you don't have any extra columns. So you already filled in your test. It says pass. We're going to go back to the export button. So this, where I'm hovering around, is your export button. You're going to click on that. So you'll see that it makes the file name for you. So your practice name will be there, and then the date that you made the test. We do ask that you only submit tests once a day, because it makes that file for you, and then if you try to submit another test the same day, it's going to come up as the same file, and it's going to think, our system's going to think it's just a duplicate, and the file is not going to make it through. If for some reason you have to send the file, add a 1 or a 2 at the end. Don't change the name, just add a 1 or a 2. Also, what's important about this file is you see that it says .csv, which is different if you look over here where I'm hovering, different from an Excel file .xlsm. So if you see .xlsm, you probably skipped the export button and just saved it as a regular Excel. So it has to be a CSV file for our system to accept it. And that's what that export button does for you. All right, so now you're probably wondering, okay, where do I save this? So you would scroll up and hit your desktop button, and then you're going to hit new file, and I would call it New Hampshire lead test. You're going to click on that file, open that up, and then you're going to save that file there. There you go. Now, when you want to exit out of this, you want to hit the X here. Because remember, you're not going to save this. It's going to prompt you to save. It's natural to feel like, oh, do I want to save it? No, you want to hit don't save. So some practices send the test through email, encrypt it. So the email that you would send it to is the lead test at dhhs.newhampshire.gov. So you can find that on the tip sheet. Remember, this is personal information, so you can't send this through the email without being encrypted. So if your practice does not have encrypted email, you have to be set up for something called the SFTP site. So that's a website you go to and you have an ID, and we have to set that up on our end. So if you were set up for the SFTP site, there will be another video how to upload to that. If you have any questions about filling out their spreadsheet or anything else about lead reporting, feel free to call me. I am happy to help you. You can email me or call me. Okay, take care.